So, hello everyone. I'm sitting here with Dorthe Raben from CHIP, from Rigshospitalet in Copenhagen. And Dorthe has been working for quite a long time with HIV in Europe, CHIP, Professor Lazarus, OPTEST, lots of things around HIV, especially HIV testing. And we know that testing week, the European testing week for HIV and hepatitis, will start tomorrow. Dorthe, why should people get tested for HIV? Why is it so important that we have the European Testing Week initiative?
Well, obviously people should get tested to get linked into care so they get the proper treatment and they are in better health and also not able to transmit the virus to others. So it also has a public health benefit, of course.
What, in your experience, how does it go with the European Testing Week so far? So how do you see the evolution of this movement, if you like?
Well, I think, as you rightly say, it is becoming a movement. It is the fourth year we are arranging it, and I think people are starting to get it into their calendars, so it becomes a yearly event that people are planning ahead for. And we have more than 400, I think it's around 500 this year, organizations across Europe joining in from all across Europe. So that's really positive, I think.
If you think about the entire spectrum of testing, and you've been working in this with OPTEST a lot, where do you see the biggest challenges in the whole testing process or paradigm, if you like?
Well, I think there's still a lot to be done because we're not seeing the decrease in the number of late presenters. So obviously we still need to improve our testing strategies to be able to diagnose people earlier. And I think some of the barriers that we have seen in OPTEST is barriers in the healthcare system, so provider barriers to offer testing. And I think we need a combination of both community testing in community and testing in the healthcare system.
Do you think, for example, that that GPs, general practitioners, or family doctors, as we call them in my part of the world, can play a part in HIV testing?
I think family doctors and also other non-HIV specialists should play a role and have a role to play because they often see patients perhaps with symptoms, indicator conditions that come in, and there are many missed opportunities or opportunities to offer an HIV test. But we have also experienced a lot of reluctance among clinicians who are not used to offer an HIV test in doing that.
If you look back at the last 10 years of HIV in Europe, and I was surprised to see or hear from you that HIV in Europe is already 10 years old, where do you see the improvements and perhaps a decline? So what's the balance right now if you look at the whole spectrum of your work that you've been doing so far?
I guess that's difficult to sum up very quickly, but I think what HIV in Europe and the initiatives around have been trying to address or do is to gather different stakeholders to make sure that we have a interaction between community, between clinicians, and between policy and public health people, and I think that has improved over the years, and it's really important if we want to tackle this problem. And the Malta conference coming up in January, February is a good sign of that, and is marking the 10 years of HIV in Europe, and will once again gather these different groups. I think also documentation and sharing of lessons has improved. You see a lot of abstracts coming into these conferences from community groups, and a lot of interaction and sharing of knowledge, which can help improve the situation in other countries.
My impression is that the work that you do is both I mean, at HiE in Europe, but also with Optest, is both scientific, but it's also to some extent political. Would you agree?
Yeah, very much.
Has it become easier or more difficult, or what is your impression?
Has it become more? Well, I guess it's to some extent easier because people are working for a common cause, and it's not are getting used to get involved across across disciplines.
Right.
I think the challenge is to engage, to really have this. The challenge now ahead is to really have this integration with other specialities and other disease areas. Both, you could say, in terms of diagnosis of diseases, but also in terms of care.
Thank you, Dorthe, very much. And we're
you.
really looking forward to hearing about the results of this year's European Hepatitis and HIV Testing Week. And I think that you will have publications and reports coming up on your website. Is
Yep.
that correct?
Yep.
Okay. Thank you.
Thank you.